Yes, welcome, beautiful people. This is 21st, and there's a topic we are doing, which is I've been having a confusion for so long. When people say they're detoxing and they're using some products that they don't know how they use, how they work. So it has risen some questions, and I decided to go through it. And I know some people have got help, and today it was a day of explaining several factors that make people confused about some products and some products they use, which is very important. It's very important to get to know the product that you use and how it works. It's very important in life. See, you may be using some products, and those products that you are using, you don't know if they are harming you or if they are being bringing any benefit to your body. So today we started by doing antioxidants. We started by doing antioxidants and detoxing, and we explained about detoxing, and we saw organs in the body which are helping the body to detox, and we explained the factors about detoxing, things that how then you did the body detox itself, the organs that are involved on detoxing. So it's very important now to clarify and help when it comes to some things that are of help to your body and to live well. There are so many things, and when it comes to marketing and health factors that are marketed in online, in papers, in brochures. And you see, when you have a product, someone would want to push it to the market and make people feel like it's the best product. It's very important, we live in a society of someone can get what someone can get through his or her hustle. Now it's very important when it comes to matter health, we be direct and we get to understand these products, how are they used and what are they bringing to the body. When you visit a medical practitioner or a hospital or anywhere and you are meeting a health worker, it is very important to this health worker to assist you to get to know what you are going through and what you are undergoing. There are some products that people have used, and instead of bringing good results, they bring so many results. And everyone uh, in life would love to live healthy life, and would love to live a good life. Yes, so that you don't have to spend a lot of money going to hospitals and buying drugs every time. If you have to avoid something so that you live a healthy life, it's very important. See that if you have to avoid some issues so that you live a healthy life, it is important. Now, let's see, let's get down and see several issues that we 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 can avoid and we can get and we can manage. You see, it's very important. Now we have issues like antioxidants and detox products. I've gone through some products that people use as detox products that you see when you talk about detoxing, people feel like you are removing bad bad toxins to your body. We saw what detoxing is. Those products that I've gone through, I sampled some of them. I will not mention some of the products. I will just say some of the products that people use. The kind of herbal teas, some juices that cleanses the body, activated charcoal. apple cider vinegar. Those are products that people use and feel they are being used as detoxing agents. Supplement label liver detox or colon cleansing, Epsom salt or magnesium based cleanses. You see, these are products that people use and feel that I'm detoxing my body. Now, here we discuss matters of health and medically and clinically proven through lab results and through FDA recognized bodies. You get it? Now, actually, let's go through these things, the products that I've just mentioned. You see, Senna and magnesium based cleanses, those are, they cause laxation. They're called laxatives. Laxatives, what they do, they empty the bowel. They make your stool be loose and then you diarrhea. And you see some people use Epsom salt or magnesium based cleansing as toxins. Today I'm just explaining about what people use, and then we will go to antioxidants. Now, you see, when you have a diarrhea, and this diarrhea comes intense, you'll have a problem. The problem you have is called electrolyte imbalance, and you'll be weak because you are losing a lot of water and nutrients that are electrolytes that are supposed to be helping your body, like sodium and potassium, magnesium. Those are electrolytes that are supposed to help your body. But you see, another thing is when you're starting the diarrhea, you feel that the product that you took is helping you. So every toxin is being removed. No, diarrhea does not remove any toxin. In another way, you are getting electrolyte imbalance. Although most of the time diarrhea may be a way of your body helping you not to retain some toxins, but it doesn't remove any toxin by inducing diarrhea. Dandelion. There's someone who told me Dandelion. Dandelion is a product, natural product that people use and say it's a tox. It is detoxifying. Yes, Dandelion is like a diuretic. You see, diuretic is something that increase urine output. When you take it, you urinate a lot. You get it, mostly water. But you know, increasing urine output may lead to dehydration and some other complication like hypotension, low blood pressure, and that may be a complication unless you've gone to a doctor and they have prescribed a diuretic proven from the pharmacies. That is another case. But this product called Dead Leon, the green teas, they cause diuresis. You urinate a lot and then you'll be dehydrated. And then we go to juice cleanses, those juices. Reduce calorie intake. When you take juices, you feel full. There are some enzymes that are blocked due to the juices. So you reduce in weight. You can like reduce in weight, which is okay. That one is okay. But you see, according to your, let's say, according to what you yourself you want to achieve, like detoxing, it is maybe if it's your main thing, it will not you will not achieve what you want. Activated charcoal binds to some substances in the gut, in your stomach. They bind to some substances but not the bloodstream. You get it? So it may not be the real case when you come to detoxing. Activated charcoal may be an antidote when it comes to some poison. So when you're using it as a detoxing agent, this is not a detoxing agent. Now we see that there are some people who use it as an detoxing agent, which is not true. Which is not true, but it has some help in other ways. Liver detox supplements mostly stimulate digestion. Liver already detoxes. You see, the liver detoxes. We talked about how the liver works. One, it changes, uh, the bad products and neutralizes them into toxins, neutralizes the toxins into something to things that are not toxic, to some elements that are not toxic. And then after that, the second phase, what it does is it changes, it changes them to water soluble so that you can remove them from your system. You know, everything that is removed from your system is removed through urination and then sweating, and then it is removed through urination, sweating, and sometimes what else? Stool. All that is a system that is programmed through water-based solution. Now we continue. These products have, as we've gone through, you rightly and you see that they are not. These products are really not detoxing. What they are doing is another thing. But you see, the real detoxing, I'll go back and say, liver, it breaks down drugs, alcohol, and toxin, phase one and two. These are enzymes that help to do that. And then the kidney filters blood, lung removes volatile substances. You remember what we said? Intestines, they eliminate waste via stool, and skin, minor role like sweat. Now, those are the confusions that we get when we go through we go through these detoxing agents and antioxidants. Antioxidants. So when you take some, like the juices that we have talked about, when you take them, they may help. These juices may help in some way, and they may help in this way. Antioxidants are substances that protect your body from damage, especially the cells, from something called the free radicals. You get it? Free radicals are unstable molecules produced naturally during the body process, like metabolism. You see, when you're undergoing and metabolism is undergoing in your body, free radicals are produced. And from the external factor also, you may get some free radicals like from smoke, radiation, infection, and stress. And you see, free radicals, as I may say, free radicals are substance that destroy your cells. Hmm? This it maybe it targets the cell membrane and proteins and the DNA. So when the cell membrane and proteins and the DNAs are damaged, so what next? You start having problems in your body. And how does free antioxidants work? They just neutralize free radicals by donating something called we call an electron. That is some chemistry in your body that maybe I will explain some other day. Now, the antioxidants, what are their importance? Because most of the vitamins that we take are antioxidants. So, what free radicals do is this: the antioxidants, not free radicals. I've talked about what free radicals do. Now I'm talking about the significance of antioxidants in the body. Now this is the significance of antioxidants, the vitamins you take. They protect the cell and the tissue from these free radicals, not to destroy them. We have already said that. And then they do something called they reduce inflammation, limit oxidative stress that triggers chronic inflammation. Important, like most vitamins, you've seen people who have arthritis, asthma, diabetes, they are being encouraged to take vitamins, mostly vitamin B. Why? They reduce inflammation. And if you may be living with someone, maybe is a diabetic or a person with arthritis, and then these people, and they have a burning effect on their legs mostly, and extremities like the hands. And these people, they tell you that I used vitamins B12 or B, and then that thing reduced. We call it uh, the burning effect in diabetes. You get it? It's just because the vitamin B reduced the free radicals and they helped the nerves. The nerves stopped sending confused signals, and then the burning effect reduced. You get it? Now, in people of atherosclerosis, these are issues with the blood vessels, like the arteries. They really help because you see the arteries are blood vessels, and when they are exposed to free radicals, mostly in blood, they may damage so fast. Atherosclerosis are toughened arteries that cannot constrict or dilate. See, if your artery cannot constrict or dilate, that is a big problem. It may end up you having some problems of high blood pressure because of the regulation of BP. We talked that earlier last year, and today we are just going overview. Now, antioxidants, the other thing they do, they support the immune system, enhance cell function, immunity function. They help the body fight infections more effectively. Infections, get it? They fight infections very effectively. And then we have prevent chronic diseases, oxidants like cardiovascular disease. You see, when you don't have the free radicals in your body, you will not get atherosclerosis. Even some cancers. Free radicals are the main culprits when it comes to some cancers. Cancers are cells that multiply within your body, and then they start doing some other things that they are not supposed to be done, and eliminating them becomes a problem. You see that. Now we have another thing called neurodegenerative diseases like Alzheimer's and Parkinson's. If you don't have free radicals, and you've been taking your fruits well, you've been taking your tomatoes. You see, tomatoes are good. Tomatoes are good when it comes to removing the free radicals. They are antioxidants. So you will not be exposed to some diseases like this. Most vitamins are key to antioxidants. And that's where I say, you see the products that people take when it comes to they say I'm detoxing. These products are antioxidants. So they help you in a way. But mostly the ones that I've seen are laxatives and diuretics. Those ones are not good. Now, there are some eye diseases like cataracts and macular degeneration. Macular degeneration, those are helped by taking some products that are of help, like they have effects of antioxidation. You see, so that is the difference between antioxidants and free antioxidants and what we say detoxing. What we say detoxing. Now we have protect to protect the brain and nerves, brain tissues. How do you protect the brain tissues and nerves? Yeah? By taking antioxidants. By taking antioxidants. You see, when you have accumulation of toxins, and these toxins are are free radicals, you are nearly close to very many complications. You are nearly close to cancer. You are nearly close to cardiovascular diseases. When I'm talking about cardiovascular diseases, what am I talking about? I'm talking about issues of the heart, cases that are prone to the heart when you expose yourself to cardiovascular diseases. The Regi podcast. Welcome, the Regi. Welcome. If you have a question, just ask. I'm just explaining the difference between antioxidants and detoxing agents. Now, you see, let's continue. Uh, Antioxidants, they really help some situations, and they really help when it comes to helping issues. You may stay away from drugs when you are diabetic. You may stay away from drugs when you have arthritis, and sometimes you may help an old person who has Alzheimer's and Parkinson's to stay away from drugs when using antioxidants. You get it? Onyx Oracle, greetings, greetings, welcome, welcome. Now, this is very critical. Where do free radicals come from? Free radicals, we have seen they are toxins that comes from smoking, pollution, radiation, infections, and stress. And some natural body process, like when your cell dies, it produces uric acid and some toxins like retinine that go through your body. So when you take orange, when you take an orange, when you take tomatoes, when you take some fruits, fruits are vitamins and they produce those antioxidants. They bind to the free radicals and they remove them to your body. You see, you have helped someone not to take some things like gabapentin. When you go to a doctor and that doctor tells you you are burning, says you are diabetic and you are burning on your feet, and the doctor tells you you have neuropathy, the burning, take gabapentin. You may as well stay away from gabapentin as a drug by using good fruits like tomatoes that are antioxidants and help you. I'm really trying to help people not to be confused when it comes to detoxing, because it has come to a matter of questions. Do these products we go to the gym with and drink as we say we are detoxing help? Please go back to the first video of detoxing. Learn how detoxing means. It is very important. Now, let's see. What are some types of detoxing agents? Some things that you may take and then they detox. No, not detoxing agents, antioxidants. You take those products and then they do oxidation, foods and fruits for me. Very well, the Real Thing podcast. Food and fruits. As a doctor, I advocate for natural things that may help your body to stay away from drugs. It is very okay. If you can take an orange and you stay away from a doctor's office, it is very important. You see, now here are some products that are antioxidants. Antioxidants are not detoxing agents. I started by detoxing agents and you saw what they do. Now, these are antioxidants. Antioxidants, what they do, they remove the free radicals. And let me give you a secret. For every cancer patient that I've seen, check about free radicals. You'll find this person is highly exposed to free radicals. Let's get to know first types of antioxidants. Endogenous, made by the body. We have antioxidants that your body make. These are like glutathione, sulfur peroxide, they stimulate. Kingre, welcome. Welcome. You're talking about antioxidants and detoxing. I know the Kingre women like to shape their body and make their skin soft. So when they go to a supermarket or a pharmacy, they find there a detoxing agent. No matter how expensive it will be, they'll buy it. Even some men nowadays. But let's see, we are on endogenous antioxidants that the body makes. We have superoxide dismutase. catalase. Those are produced by the body. And glutathione. You know, glutathione helps your skin. Although you can buy it on the market, it's not bad. As we go on, please don't remain. Like the video and share. This video may help someone. Water first thing in the morning with lemon. Very important. Yes, very important. The real thing. You see, lemon is a fruit and it's a antioxidant. But if you have ulcerations, you limit the amount of lemon that you are taking. Now, exogenous. Those that Exogenous are antioxidants that they are not produced by the body, but you need them, like vitamin C from oranges and lemons. You see, the real thing, vitamin C comes from lemon. It's a very strong antioxidant. Please like the video, share, and if you've not subscribed, please make a wish and subscribe so that you may be getting my lives. You see, where I usually talk about medical issues on my lives. So if you have not subscribed, you may not get the notification. It's important you subscribe. And if you have a question, my email, everyone has it. I'll write it down. You ask. Let's continue with vitamin E. Vitamin E from nuts, seeds, vegetables, oils. It's an antioxidant. This one captures free radicals, removes it from the body so that you cannot get the cancer. So that if you are diabetic, you may not get neuropathy on your feet. You may not get that burning sensation or a feeling of tiredness always. Selenium. Selenium is a good antioxidant, and to get it from fish. Fish and eggs, but don't overdo eggs. You know, they have high cholesterol and it may be a problem. Do just what you are required, like 1 or 2 in a day is okay. And we have vitamin A, beta carotene, your eyes. When we talk about vitamin A, people think of the carrots, sweet potatoes. Even sweet potatoes have beta carotene, that is vitamin A. Vitamin A. Very important for your eyes because it helps the rods and the opsins. But in another way, it makes you stay away from the doctor's office by capturing the free radical that brings you arthritis, diabetes. You see, it's very important. Then we have something called polyphenols and flavonoids from tea, coffee, fruits, and vegetables. Those are the real antioxidant. Now, let's not confuse antioxidation agents from what? Detoxing. Antioxidants, they just help you to to capture the toxins and remove them from your body. Detoxing is another thing that the liver, the kidney, the lungs do. And we saw it from our first chapter of Detox. So if you want to live better in life and protect your organs like the liver, the kidney, and the lungs, you do what? You use antioxidants. You use antioxidants so that you stay away from complications. And I've said there are those antioxidants that are produced from your body like glutathione, superoxide dismutase, and catalase. Those ones are the body. But if they are not enough, you can use these ones that you can get from your farm or the supermarket or the vegetables shop, your grocery. Vitamin C, oranges, lemons, very important. Vitamin E, which is the nuts, seeds, vegetables, oils. And then we have the beta carotene, the carrots, a very strong antioxidant. And sweet potatoes. Sweet potatoes, I don't know which in your country how you call it, but here we call it the sweet potatoes. They have vitamin A. Selenium is a very good antioxidant from fish and eggs, but limit the amount of eggs you're taking because of calories. We have something called polyphenols and flavonoids. When you take tea, coffee, fruits, and vegetables, you've had some people when they haven't taken tea in the morning, when it comes to 10, they start having headaches. It's because the antioxidant rate that you are used to, you haven't taken, you haven't fed your body. So the body is struggling to bind to some elements and you have not given it, mostly binding to the free radicals that are bad. So please take check the tea that you are taking, but I've not said the tea that people say it's a detoxing agent. This is the natural tea that we take from our farms and then it is manufactured to the supermarket. We buy and use it. Fruits that we take and vegetables. Vegetables are very important. Vegetables are very important. Now, antioxidants. I've talked a lot about antioxidants and free radicals. Free radicals, when you burn oil, like the fries that you use, oil is healthy in free radicals. What do the free radicals do? And these ones are the things that we should remove from our bodies very fast. And we should avoid them because they are the culprits that bring us cancers, arthritis, diabetes because of insulin resistance. What do we do? Free radicals damages the cell walls inside your body and the DNA, and then it causes oxidative state whereby your body is struggling to make things that are not coming up, and then promoting aging and diseases. When we are used to free radicals, you age faster. Someone looks at you and sees you are older than your age. And I've said, burning oil continuously and using them, you are giving yourself rich free radicals. You get it? That's why people ask themselves, why were our ancestors living more than us? It's because us, we are used to free radicals. We burn oil much. We eat things that are sweet that are burned from oil, fries. But when you roast and you boil, you reduce the amount of free radicals that you are taking. So it makes you look more younger than you were. You get it? And you prolong your life and you reduce cancers because we have seen free radicals bring cancers. So at least today you know why people age so fast. And then we go to another one here called the antioxidants. This is the opposite of the other. Antioxidants, we have seen vitamin C, E, A that we get from carrots, fish, fruits, all of them. They protect your cell wall by binding to the free radicals and removing them. And then we have reduced oxidative stress. Your body oxidative stress is reduced, so you look more relaxed. You don't look tensed. Your head is not aching. You get it? Sometimes you wake up when you are tired. When you use antioxidants, you don't. You get it? And it prevents aging and diseases. At least today's topic, I've talked about the most important thing and I've differentiated between detox and antioxidants. The products that you take as detox, I've said from the beginning what they are and I've categorized what they do. So please, I think today's topic will end there. We will talk tomorrow on how to reduce lifestyle diseases like cancers, obesity, diabetes. We will talk about it and we will give an overview of how cancers come, although I've given them right here. So if anyone has no question about the topic of today, or anyone has a recommendation, or can tell us what we 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 have to do, or you are contra to what I'm saying, or we can discuss. I'm giving this chance, and sometimes we learn from the products that people use for a long time. They give us experience, so I don't overrule anything that someone tells me. If I'm not in cooperation with it, I go to research on it. So if you have any idea, anything, I give you a way to tell us or a question. Some room, and it's 35 minutes of a lesson. Thank you everyone to be here. Unless I'm waiting for anyone who has a question. I'm waiting for anyone who might be having a question. Okay, I see there's no question for today. We will meet next time to talk about how to stay away from lifestyle diseases using natural ways. Be blessed, everyone, and stay blessed.